put it in and we don't have a Horner syndrome, I take those patients right back and I do more because I want to see that. It means that I'm numbed up the target area because there is a connection from the neck to the brain. If people don't have a droop, it means I miss and it's not going to work.
One of the symptoms afterwards was a hoarse throat. Is that from the injection or is that from a response?
That's from the injection. That
Okay.
the provider who did my procedure has improved that technique since, and it's better now. It's operator dependent, meaning how many you've done and how good you are at it. It's not. It's a known side effect. It happens about 5 to 10% of the people. In my hands now, it almost never happens, but it's possible. All that means that local anesthetic, instead of being on a target, is there and it went somewhere else. It spread somewhere else. So there are ways to contain that.
And then in the video, I wanted to share a kind of an emotional response I had. And again, I don't want to be the guy that said, I'm not. Let me see. I don't want to discourage people from looking at this that are in recovery. This is just a personal thing that I want to share and then get your
Your
feedback on,
perspective.
because I do feel like it's, yeah. So you, one of the things you said is like why that you don't feel the ice constricting your heart, and that you can't believe that you're still fighting people for this. That you feel like you can just go home, do some therapy, and move on with your life, which I thought was an important point, that there's still some kind of work to do, that maybe this isn't the end all be all. But then you said that it's just a needle and a local. Now for me, that kind of like that was a little bit triggering, because I grew up in a home that my dad took methamphetamine. They both used used a needle for IV with methamphetamine, and that's kind of how he described methamphetamine, was like it'll make you successful, it'll make you'll feel better, you'll physically be able to do everything. It was the end all be all in his eyes, and so I learned that growing up. And when you said that, that was exactly what kind of went off. And I just wanted to ask what your thoughts on it. And I know it's probably way misplaced.
No, I mean honestly, one thing, I've done 40 years of clinical medicine. I never judge anyone. You are where you are. I mean, I'm not going to judge it. I don't have that analogy at all. In fact, I'm going to give you my answer, but I would be interesting to see how you'd phrase the same information. The reason I phrase things the way I phrase things, I like to be very direct. The problem is, to me, a lot of my psychiatric colleagues, people poke around, they never get to the point. It's like, okay, can you get to the point? How am I going to get better? What's involved? What are you actually doing? Round and around. That, I mean, to me, that gets me, that's my particular craziness, right? That gets me annoyed. Just tell me the answer. What are you doing? What are the risks? And I'll make my decision. I don't need this around and around and around. I talked to somebody recently, they just give me this around. I was like, just give me a direct answer. Can you just give me specifics? That's how I work, right? And frankly, if it frightens people, then they're not the right candidate. You have to, it's an invasive procedure. It's minimally invasive, but I still have to pierce the skin, right?